Distinguished guests, ladies and gentlemen, first of all, I must apologise for my rather broad, strange accent. I come from a land far, far from here, from a little place called Australia on the other side of the world. And coming in last night, it was interesting in my discussion with the taxi driver. We were talking about how Australia has a really strong connection to Malta. And he indicated to me there are actually more Maltese of heritage living in Australia than there actually are in Malta, which I find quite remarkable. But we're very happy that we have the Maltese community because the culture that they've brought to our society, and particularly the cuisine, I very much like. So thank you very much for the opportunity to present to you today. As was mentioned in the introduction, I am actually a police officer from Australia. I'm still a current serving police officer. I'm on a leave of absence from my organisation working in the international community, working for an organisation called the Global Road Safety Partnership. And I'm based out of Geneva in Switzerland. We're a hosted program of the International Federation of Red Cross and Red Crescent Societies. And our work works across a number of humanitarian organisations, mainly the UN, the WHO, and we have a number of civil society organisations, multinational companies and national governments that are members of our organisation. My specific role is to work on law enforcement and working in predominantly low and middle income countries around institutional strengthening and capacity building of police leadership teams and the institution of policing. So working on developing roadside practice, working on technological interventions, working on strategy, corruption prevention. So there's a range of things that we're doing. And so we work in a small team, working across Latin America, Asia, Africa. And I'm very delighted to be here today in Malta to talk about the experience of contemporary best practice enforcement. Now, since the 1970s, there's been a series of brave legislative reforms that have been introduced to look at alcohol and drug misuse in society. The development of road safety partnerships is probably one of the most profound things that have really accelerated the road safety sphere. In isolation, siloed thinking will not work. Enforcement, particularly on its own, will have very limited impact. And I will talk about the Australian experience particularly because my home institution is responsible for many firsts. We have a very strong and rich history of road safety stemming back to the 1970s when our culture and our society was very different to what it is today. Back in the 1970s, with a population of about half the size of what it is today, of around 3 million, in my home state of Victoria, we had 1,000 deaths in 1 year on our roads from a population of about 3 million. If I fast forward to today, our population has more than doubled, our vehicle fleet has tripled, but our death and injury has been reduced by more than 80%. And in our last year, in 2018, we recorded our lowest road toll on record. So that is the level of death occurring on our roads at 213 citizens from a population of 6.2 million people. Now that has not happened by accident. It's been very deliberate decisions with political will, with very strong leadership and good community understanding of the risks. And that happens by way of what we call the safe system model, where we focus on safer vehicles, safer speeds, safer roads, and safer people. And central to all of that is the human tolerance to crash forces. So our system is designed to protect the most vulnerable. And there are a number of inputs to support those 4 pillars, those 4 safe pillars I talked about. Safe, so education, enforcement, innovation, research, strong legislation, which brings me to the drink driving discussion. But there is still so much more that we can do as a society, and we do not accept death as an inevitable cost that our community have to pay to become a road user. So when we look around the world, I must just reinforce that you are not on your own in terms of the current practice for enforcement of drink driving or drug misuse on the roads. So when we compare the 165 member countries that submit to the World Health Organization's Global Status Report, of those 165 countries, there are 17 of those, that will do strictly sobriety checkpoints only. There are 48 countries that will submit to random breath testing, and there are 59 countries that will do both roadside checkpoints and random breath testing, and I'll unpack that in a little more detail shortly. But then there are another 59 countries that don't do anything at all. So in the context of the global community, you're certainly not the worst, but you're not the best. And I think on hearing from our distinguished presenters this morning, clearly there is much more that can be done. It really gets down to the will of the community, the will of the leaders and the politicians, and the support from the judiciary with strong legislative powers for the police to enforce. So why is drink driving a primary risk factor? It's behind speed, it's probably the second greatest risk to citizens using the world's roads. So majority of adults will become impaired with a blood alcohol concentration of 0.05 or more. And it's pleasing to hear that you've made the shift from a level of 0.08 to 0.05. Inexperienced drivers are at twice the crash risk at 0.05 than normal drivers from fully licensed drivers, so novice drivers, young drivers between the ages of 18 and 24. In low and middle income countries, between 30 and 70% of all deaths are related to alcohol or alcohol and other drug misuse, what we call polydrug use. Alcohol in the body is linked to a higher risk of death and serious injury. It also limits the recovery rates. So when we're talking about post-crash care, the level of intoxication will also play a significant role in the recovery and recuperation of the victim immediately after the crash. And clearly, other drugs, as I mentioned, polydrug use is also a considerable emerging risk. Sadly, there are few countries that are working towards interventions to reduce death related to drug driving, and it is not well understood. But there are examples of where contemporary good practice could assist in the Maltese context. So when we look at the influence of alcohol on driving, I think this simple graph pretty much explains it all. So alcohol produces physical and physiological changes in the body. And as Madam Justice displayed in her presentation earlier, for a normal functioning person using fine, complex motor skills to operate a motor vehicle where you've got various inputs and quick-fire decisions that have to be made, that is difficult enough to be able to navigate around a complex road environment. But when you take into the mix inexperience, when you take into the mix alcohol, age, distraction, those risks are exponentially increased. So as you put each layer into the environment, the risks increase significantly. When we just look at alcohol alone, at 0.05, the average driver is at twice the crash risk. When we look at 3 times Malta's legal driving limit at 0.15, the risk increases to 25 times the rate. So if this is not a compelling enough argument to do more, I'm not sure what is. These effects of alcohol have been demonstrated by closed course simulator and laboratory-based studies, so very controlled environments, epidemiological studies that show the crash risk increases dramatically. So there's been a lot of work over a significant period of time that has proven the risk that alcohol plays across a society, not just in road safety. So when we look at random breath testing, I'm very proud to stand here and say that my home state and my home country is responsible for many firsts. The first jurisdiction in the world to make it mandatory for people to wear seatbelts in cars, way back in 1970. The first jurisdiction to introduce random roadside breath testing for alcohol. The first place in the world to introduce random roadside drug testing. The first place in the world to introduce mobile speed and fixed camera technology. So a range of interventions that have helped improve our society's position when it comes to road safety. So when we introduced random breath testing, so both roadside checkpoints and random breath testing, there were some unique things that we needed to consider. But essentially what this means, if this is not the practice that occurs at the moment, in my experience and in many of the high-income countries where random breath testing occurs, it allows for the stopping of a driver without police being required to have previous knowledge. So that term reasonable suspicion, in my legislative context, it does not exist. It's based on a position that the greater majority of the community needs to be protected over the impact that it has on an individual to stop them for a very short period of time for the purpose of a breath test. And I think this particular statement sums it up pretty well. So a minor infringement on personal freedom by stopping that person's movement to test the presence of alcohol is far outweighed by the collective safety benefits to the wider community. And so when our agency, our key road safety agency stakeholders came to this position, it was a really strong and powerful position that helped project us forward, because we didn't have one agency in isolation standing up there trying to defend a position. We had a collective and united front of leaders and key stakeholders all giving the same message, that what we are trying to achieve is to protect our most vulnerable citizens and our broader community. And the objective of the legislation is to identify and prosecute all drivers found to have alcohol in their system beyond the legal allowable limits. So 0.05 for full licence holders is the limit in Australia. 0.00 for commercial drivers and for all emergency service and essential service drivers. So heavy vehicle drivers, mass fleet drivers, taxi drivers, and then 00 for novice drivers. So up in the first 4 years of driving, a young person is not allowed to have any alcohol in their system whatsoever. So our testing is conducted in a very intense and sustained manner, and I'll talk through that and give you an example of it in just a moment, hopefully if the technology works. We utilise a mix of highly visible, so when the police go out there, the livery of the vehicles are branded drink and alcohol testing. We have what's called booze buses, so booze, the colloquial term in Australia for alcohol. So on the bottom left-hand corner of the slide, you'll see the type of testing vehicle that goes out to the side of the road at a checkpoint. So anybody that is driving past it is well aware of what the enforcement intention is. And when we look at deterrence, and specifically general deterrence, it provides the message to the community that this behaviour won't be tolerated. We then run a series of static and mobile operations. So we may do large volume testing where we block down a whole road and any vehicle driving through the site will be tested. Not necessarily every test. So we'll look at our surge capability, and where we have a build-up of traffic, we will divert some vehicles into the testing line and we will wave others through. But then on the odd occasion, if the surge isn't that great and we don't have peak periods, we will then test all drivers through that site. In addition to that, knowing that people can be cunning and they will look at ways to circumvent the testing, we will run satellite activities in mobile police cars around the feeder roads in the event that we have people try and turn off and get away. We utilise a mix of targeted and random testing, so we use what we call an evidence-based, intelligence-led approach. So we gather information during the investigation, so when a person provides a sample of breath, they are then taken from the testing line, so their vehicle is diverted off the line, it's parked, they're invited into the bus, and they undertake an evidential breath test. At that point, we ask them a series of questions about their level of consumption, what they were drinking, when they were drinking, who they were drinking with, at what venue they may have been at, was it a private residence, a licensed venue, and all of this information is then collected and collated and analysed and interrogated through a database where we can then start to plan the key risk times for detection, generally on a Thursday afternoon from 4 p.m. right through till about Sunday afternoon, generally afternoon commencing at about 5 p.m. through to 2 or 3 in the morning. So rather than be reactionary, we will deploy our resources in advance of the harm occurring in a preventative and proactive sense to deter, not to react to the harm, but to deter the harm. So we use a very evidence-based approach to what we do. And one of the most important things is this last dot point, and that is using mass media campaigns to support our operations. So at particular times of the year, seasonal periods around major festivals, at Christmas and Easter, where people will take holiday breaks, they will go off, they will be out of routine, they will socialise, there is a likelihood that their level of consumption of alcohol will increase. We will also increase our enforcement across our whole organisation. And so we will advertise in advance using the support of our Transport Accident Commission, so our state insurer. So in Victoria, when you register a car, you pay a small premium as part of your registration, which goes into a third-party insurance scheme, and that money is then used to pay for costs related to road crashes. It can also be diverted across to support additional police enforcement through extra overtime, technology procurement, and for supporting mass media campaigns. And so when we run activities, we ensure that all of the key stakeholders are aware of our timing. We articulate that through mass media campaigns and public education, and then we back it up with strong enforcement activity. So if we look at, this is just specific to drink driving, but you look at our road deaths over 0.05 blood alcohol concentration from back in 77 through to 2010, and there is a more recent slide which unfortunately I couldn't have available for today, but there are some additional interventions beyond 2010 that have occurred, which I'll explain in just a moment. But starting way back in 1976, we introduced roadside breath testing. In 1983 was the first use of those alcohol detection buses and putting 10 to 15 police out on a line together in large numbers. In 1990, we introduced volume testing, so then looking at multiple buses around a particular geographic zone or on feeder roads into high-risk locations. Then in 2002, we updated our fleet and branded them to what you have seen and you'll see in another slide coming up shortly. Then in 2004, we introduced random roadside drug testing in addition to the alcohol testing. And then we look at the expansion. So we're initially funded for about 30,000 preliminary oral fluid tests, so drug testing kits. Now today we're funded for about 150,000 roadside tests. They are expensive, but we are seeing the cost over time as the global community start to mobilise around the issue of drug driving. We're seeing those costs come down. So what we found that in the early part of this slide, whilst we had significant reductions, there was a point around 1983 where we started to plateau and started to climb again. And what we realised that whilst we did have some impact, it wasn't sustained because people then became a little condition to our activities. So we then looked at introducing random testing, where we were much more agile in terms of our flexibility to move around, and empowering the police through legislative changes to allow any police officer to intercept any driver, anywhere, anytime. So our model is based upon Professor Ross Hommel's theory of deterrence, well known in the international road safety community. So the theory of deterrence is based upon simple behaviours. So looking at mass populations and looking at people who might not necessarily go out to behave deviantly or unlawfully, but because of circumstance they might decide to make a decision to drive when they know they may have consumed a little more than what the law allows. So we have adopted penalties for exceeding the limit that are quite extensive, which range from fines, loss of licence, impoundment of vehicles, fitting of alcohol interlock devices to cars, and those costs borne by the driver or the offending driver. And as the blood alcohol concentration level increases, with that increase in risk comes an increase in penalty. Such is the deterrent value that has. And then we have more complex behaviours where we have recidivist offenders, known recidivist offenders, high-risk locations for alcohol consumption, and then people who will drive. So, as I mentioned earlier, music festivals, sporting events, seasonal periods. We will also then structure our activities around those deterrence behaviours. And across a population of approximately 6.2 million people, in a calendar year, we'll conduct about 4.5 million breath tests. Such is the volume of testing. So we've shifted from a position when I was a child, and I had a conversation earlier in the car with one of the colleagues here about how effective children can be to educate families. So when I was a child, I have a very vivid memory of my father, and he'd probably turn in his grave for me standing up here telling the story, but we went to a significant sporting event. We drove nearly the hour home, and about 3 kilometres from our house, my father was detected for drink driving. He went before the court. He lost his licence. He was able to keep his job. He applied to the court to get his licence back because the family would suffer. There would be financial hardship as the primary breadwinner. I shifted today, and it is completely socially unacceptable in our community for people to drink and drive. And there will be no support amongst friends or family or colleagues or employers if you get caught. And if you require your licence for your employment, chances are you're not going to have a job. So there are other cultural aspects that have shifted with the legislation and with the reforms and with the advancement of technology, and it's really pleasing to see. However, having said that, there is still so much more that we can do. And we can't accept that there will be a percentage. Our vision is a vision where no person is injured or killed on our roads. And so we have strategies across government and across police and other agencies to support that vision. So our enforcement activities, when we look at Hommel's deterrence theory, enforcement activities should be highly visible. So as many drivers as possible exposed to the police testing. It should be rigorously enforced, and so nobody avoids the testing. And this is when I specifically in some of the low-income countries where I don't condone it, but I understand how they've ended up in that position. But nobody is above the law, regardless of whether you're a police officer, a politician, a public official, a sporting identity, a reality TV star. Everybody is treated equal at law. And in fact, once again in my context, if you are one of those people in one of those occupations, chances are the penalties will be much more severe because they should have known better. So the best practice principle is based on anybody, anywhere, anytime. It must be sustained. So we can't just say, we'll put our foot on the accelerator today, we'll do thousands of tests, and we'll do that for the next few weeks, and then mission accomplished, tick, job done. There has to be ways to sustain that long term and build it in to standard operating practice. But that comes at a cost because it requires resources, it requires technology, and it requires a well-trained organisation to do it. And the last part, once again, I'll continue to harp upon this because the message needs to be sold, and that is it must be supported through media, mass media campaigns and education, because that enhances the impact that the enforcement activities have. So I'm hoping this will work. I'm not sure which button I'm supposed to press, but this is an example of a seasonal campaign around Christmas. And the play on the messaging here is around the Christmas seasonal period and the enforcement that is undertaken during that time. So this will go out weeks in advance through television, digital media, through print media. We will have our figureheads, our key spokespeople out on the front foot talking about the risks that we know will occur, the death and injury that is likely to happen as a result of drink driving and other unlawful behaviours. And everybody will see this on billboards, in newspapers, through their social media feeds. Just while they're setting that up, the next few slides, and I appreciate that I'm limited to time, so I have to hurry up and move through this presentation. And I'm happy to make myself available for questions after the presentation is over at the end of
Some
today.
people will get a written invitation. And of course, they'll be keeping an eye on numbers and checking IDs. There'll be loud music, flashing lights, and they'll take loads of photos. They've got glow sticks, an endless supply of straws, and lollipops. You won't have much to celebrate. Of course, some will be surprise guests, and others will want to stay on.
Keeping the roads safe is everyone's responsibility. We'll be out in force making sure you play your part. If you don't, the party's over.
So unfortunately the audio didn't match the video footage, but I think you get the context of what was the aim of that particular campaign. And that's one of a multitude of mass media tools that we use to support our activities. And what it does is it informs the community, first of all, of what our actions are going to be. So you can't give the excuse that you didn't know. Secondly, it legitimises the authenticity of the enforcement intervention. Thirdly, it plays into our hands in terms of an educative process. So every officer is also well trained in terms of the script. So we call it the theatre of policing. So they're aware of the script, they're aware of what they have to say on the side of the road, that one-on-one interaction that they play with the community, and how their interaction can either underpin and support the activities that are being undertaken or can actually work against them. So I mentioned earlier that they're well trained and the message is well understood. I'll now move to some of the technology that we use. So this is a preliminary breath test on the left-hand side. So it's a very simple device to use. It can happen in rapid succession. The testing takes, probably 30 seconds, as long as it takes as a vehicle comes through the line. The test is given, the person provides a sample of breath, and if they have a negative result, they're moved on very quickly. If they produce a positive result, they will be taken off the line so we can continue to conduct the preliminary testing and keep those lawful citizens moving so we don't impact upon their time any more than is necessary. The person who produces the negative test, or the positive test, they're taken to the bus. They're then given an evidential breath test. So one just indicates the presence of alcohol. The second one determines the level of intoxication. So when we talk about procedural fairness and natural justice, and we look at the human rights of an individual around freedom of movement and liberty, our legislation combines for all of that. The evidential test is then produced. Interesting, Madam Justice talked about powers of arrest. We actually don't have one where I come from. It's the citizen's choice whether they choose to submit to a test or not. If they refuse or fail the test, however, the penalties are more severe than what they would be for providing a sample of breath if they had alcohol in their system and they were fined and lost their licence. It's a mandatory or compulsory 2-year loss of licence if you refuse or fail to undertake a test. So if a person's on the side of the road and they say, no, I'm not going to do that, we will go through the process explaining to them what the consequences of their behaviour are. And if they continue to refuse, they're then, all their details are taken down and they're presented before the court, and they will lose their licence for 2 years. A person involved in a crash or a fatal accident, we also ensure that every driver is tested. And how we got to this position in the first place, and I had an interesting conversation during the break, and it gets back to having a good evidential understanding of your problem. And the comment was made this morning around, should we look at mortality data? And I understand the religious and cultural contexts of what that actually means. In my context, in my society, in my country, we conduct autopsies, and we have a saying, if you don't measure it, you cannot manage it. So understanding what the impact of alcohol is on fatal collisions. So we looked at a number of fatalities which provided enough of an indication to us that we had a broad-scale drink driving problem in our community back in the 70s, and that became the catalyst to introduce legislative change. And then over time, as we've improved and increased and changed our behaviour, we've brought the community along with us. And so there is no challenge, there is no argument when a person is stopped for drink driving in the context that I come from. But I shouldn't just emphasise from where I come from, because in New Zealand, in France, in parts of the United States, there are other places around the world, Germany, and in South Africa, where these same principles that I'm talking about have been implemented. So I now move on to what is an alcohol interlock device. So an alcohol interlock device is a sanction the court imposes on a person who provides a positive sample of breath and is convicted through the courts, or is given a penalty notice or a ticket and they pay the fine. Earlier last year, in April last year, 30th of April, new legislation came into effect where every driver has to have one of these fitted to their vehicle if they're found guilty of drink driving. So the cost in terms of that is borne by the offending driver. So the fitting is around about €100, about 130 euros to have it fitted to the driver's vehicle. They have to have it fitted for a minimum of 6 months at a cost of around €80 per month to pay for the maintenance of it, and then they pay around €50 to have it taken out of the vehicle at the end of the sanction. So end to end, it's quite a significant process when you think that they're going to lose their licence in the first place for a period of time, generally a minimum of 3 months for low-range drink driving. They will then, once they get their licence back, have to have an alcohol interlock device fitted to their car. They have to bear the cost of it, and potentially they're going to lose their job because they don't have their licence to get to work in the first place. So the sanctions are very high. This was some of the media that went with it at the time it was introduced, and it was put across every major syndicated newspaper, across our digital media, across television news. An example of our livery, our fleet that we use, so .05, drugs, police, that's the sort of vehicles that we deploy as part of our testing. Importantly to this also is the capture of the data. So when we look at an evidence-based, intelligence-led approach, this is a lot of the work that GRSP is doing in some of the developing countries, the low and middle income countries, around data collection and strengthening the data collection. So the devices will tell us, it will record date, time, location, It will tell us the level of sobriety. It will tell us the gender. There may be other enforcement outcomes as a result of that interaction. The person might not have had a seatbelt on. They might have been in possession of drugs. They might have been using their mobile phone and been distracted. So a range of other summary add-ons, if I can use that term. And then it will also capture false or refusals. And when we're calculating the numbers, we treat those as a positive test. And then over time, using this data, we can then start to deploy into areas and known locations at high-risk times on where the enforcement activity will take place. And it is possible to do. I'm currently working in India. I'm working in Accra in Ghana. Part of my work takes me to Ethiopia, to Bogota, to Fortaleza and Sao Paulo in Brazil, into some of the Asian countries. And in a short 2 years, we're starting to see really good success with some of these activities based on some of this information that I'm providing to you today. As I mentioned, every driver, there is no exceptions. Every driver is breath tested after a crash where the police attend. And up to 3 hours afterwards. So if a person crashes, they leave the scene, we have 3 hours to get to them to test them. If they're taken to hospital and they can't provide a sample of breath, it's a requirement of the admitting physician, so the emergency doctor, to take a sample of blood, and then it's sent off to the lab for analysis, and then the police are sent the results, and the hospital data is merged with the police collision data to then look at what sanction or what process will be taken moving forward. So every driver stopped. I just cannot reinforce the importance of that point. I've talked a lot about enforcement. I've talked a lot about mass media campaigns and education. This is an example of some of the work that our road safety stakeholders do to support us around public messaging. So they are surveyed, as you can see on this particular graph, from 95 through to 2015. So we're looking at a 20-year history of surveying drivers about attitudes or perceptions they have about drink driving. And you can see that over time there's been a shift in all categories in relation to their understanding and their perceptions of, one, the risk of detection, the risk of crashing, the type of enforcement that's taking place. And that is shared amongst agency partners to ensure that we continue to review and analyse and refine our messaging, our education and our enforcement tactics. So that's drink driving in a quick snapshot. Very quickly about drug driving. So this is taken from an ETSC study. So Frank talked earlier about a study in his slide called Druid. So the reference is at the bottom of the slide here where this has come from, specific to the European Union. So drink driving is a more prevalent cause of road death and injuries. 24% seriously injured drivers and 32% of drivers across the greater EU. Psychoactive drugs are found in about 15% of seriously injured drivers and about 15% of killed drivers. Drugs are found in a combination with alcohol, so that polydrug use. And the most common one, and this is the most common one where I come from as well, is cannabis, followed by cocaine and amphetamines. There is a significant risk injury. So when we compare drug use and a combination of drug use against alcohol, so where you've got an injury risk of drugs combined with alcohol, it's similar to the risk of somebody with alcohol in their system driving at 0.12, so more than twice the legal limit. And importantly, it is not well understood. The drug culture and the way in which synthetic drugs are rapidly changing and transforming, it's difficult for us to keep ahead of it. And there is much more work that needs to be done. In the Australian experience, as I mentioned, my home jurisdiction was the first agency in the world to introduce roadside random drug testing based on our success with drink driving. Whilst we can test for many more substances, through our mortality studies, the three prominent drugs that were being used in our community were methamphetamine, tetrahydrocannabinol, which is the psychoactive substance, THC, and then MDMA, or known as methylene dioxymethamphetamine, the three key drugs that we find through crash data and through mortality studies. So we're funded by government. This is an example of the roadside test. So it's a very simple process where the driver is asked to provide a saliva sample. So the top right-hand corner, those two little cotton pads, they place it down their tongue, it goes into a device, and very similar to a pregnancy test kit, it will have an indicator line whether they are positive or negative. It does not test for the level of toxicity. The position that we've taken is absolute. It is either in your system or it is not. And unfortunately, the challenge for young people is that they take these psychotropic substances over a weekend, not realising how long it may stay in their system and how it can still impact them, and they will take the risk to drive. So we'll do the roadside test kit. That's the preliminary test, a preliminary oral fluid test. Then we take them into the testing vehicle or back to a police station. We will take a secondary sample. We will send that off to the lab. And in a clinical environment, in a completely objective, independent setting, that test is done, and then the results are sent to the police, and there is a subsequent enforcement follow-up and potentially a conviction. Finally, I know I've probably gone a little bit over time, and I'm sorry for that. All of those things that I've talked about, they are achievable. Whilst it has taken us a long time, I think the learnings of societies like my own and other areas around the world, there is opportunity to accelerate some of those learnings and accelerate your road safety position. Importantly, standardisation of roadside testing procedures is really, really important. Well understood by the police that are enforcing the law, the process used, the tactics, the operations, the planning. Introduce well-prepared training programs based on international best practice. Looking at standards of drug levels and what type of drugs may be prevalent here in the Maltese community. And knowing that this is a tourist haven, just think about the risk that is coming in through your borders. Coming in via sea, coming in via air, people from other cultures who want to party and are involved in drug culture. You know, this isn't just exclusive to the citizens of Malta. The risk can be brought on shore by people being here who have very liberal views and are prepared to overstep their boundaries as a guest in your country. So there is also an obligation to protect your citizens from those risks that are coming in externally. It should be focused on evaluation. So this cyclical model of constant review, evaluation, refine and implement. And then finally, looking at international standards for data collection, monitoring and analysis. So that pretty much sums up my presentation. If you would like to know a little bit more, there are a couple of resources in the international community that we often refer to draw upon experiences and look at roadmaps moving forward. A great amount of work has been done around drink driving through the World Health Organization manual, and a recent one which is more broadly about road safety and saving lives. Thank you very much.